A very good morning, Dr. Maarman. Please tell us, first of all, what exactly pulmonary hypertension is, and then elaborate on some of these findings.
Good morning. Thank you so much for inviting me. So pulmonary hypertension is really just exclusively high blood pressure that happens in the lung, as opposed to usual hypertension, which is more systemic. And it causes symptoms like shortness of breath, or we call it dyspnea. Some people develop what we call dizziness spells and chest pain and so forth. And we've noticed in this review that my colleagues and I have conducted that about 75 million people worldwide have pulmonary hypertension, and 80% of those patients live in low-income and middle-income countries, of course, including South Africa. And this is essentially pulmonary hypertension. It is extremely complex disease, has about 5 different categories according to the World Health Organization.
So why is South Africa at such a high risk of this disease, and what is the link then between pulmonary hypertension and the likes of HIV, bilharzia and TB?
So pulmonary hypertension is a problem in South Africa, mostly because of the risk factors for, and these risk factors are diseases like tuberculosis, chronic obstructive pulmonary disease, which includes asthma, emphysema caused by smoking, chronic bronchitis, and what you say, bilharzia or schistosomiasis. And these risk factors really augment the risk for patients to develop pulmonary hypertension at a later stage. We have to remember that pulmonary hypertension is a fatal disease, and it's a clinical nightmare to manage. The treatments that are available in the low and middle income countries are doesn't come close to the treatments that are available in, for example, Europe and the USA. And so therefore, pulmonary hypertension is really a problem for South Africans. We know of thousands of patients in South Africa who have died of pulmonary hypertension, and probably millions who are at risk of developing pulmonary hypertension.
Now, with these fatalities and difficulties with treatment that you mentioned, how does one then effectively try and fight pulmonary hypertension, or at the very least, even protect yourself from it in the first place?
The problem with pulmonary hypertension is that the symptoms that patients experience, something like shortness of breath, most of these symptoms are really inconspicuous or even nebulous, so it's difficult to notice and sometimes even difficult to see. And because of this, the patients can miss it, but as well as the primary healthcare doctor can often miss this, and this leads to either a misdiagnosis of the disease. In other words, a doctor doesn't know that it is pulmonary hypertension and then would treat for something like heart disease or anything else. Misdiagnosis as well as a late diagnosis. And the problem with pulmonary hypertension is that patients are diagnosed so late, and by the time that they get to a tertiary institution, these patients have about 3 to 5 years left of living, and that's unfortunately the sad case in South Africa. So what we need to do is to raise awareness in civil society and public, but even raise awareness amongst primary healthcare doctors to say that if a patient comes to your clinic and they present with tiredness and shortness of breath, let's do an advanced clinical investigation or clinical exam, and if you're not sure and the patient is not responding to first-line treatment, make sure that you refer that patient to a cardiologist as soon as possible so that we avoid losing people to this disease.
Of course, one can't speak about this disease, pulmonary hypertension, and not try and find some sort of connection to COVID-19, which really this year has been all about coronavirus, hasn't it? So are there any links between pulmonary hypertension and COVID-19? Do we see COVID manifesting itself a little differently with someone who does suffer from pulmonary hypertension?
Certainly, there's definitely a link between COVID-19 and pulmonary hypertension. So either a patient can have existing pulmonary hypertension, and if they are infected with the virus for SARS-CoV-2, they would get COVID-19, and these patients are most likely to die because of COVID-19. But in the other, the flip side of the coin, we know that there's a link that patients who have severe or moderate COVID-19 may even later develop pulmonary hypertension as a long-term consequence. So we are now conducting a study in 21 different countries to look at patients who had severe, moderate COVID-19. These patients have recovered of COVID-19, but now the question is what happens long term, and we suspect that many of these patients might actually later develop pulmonary hypertension. So we sort of need to look out for that.
All right, thanks, Doc. We'll leave it there. Dr. Gerald Maarman from the Center for Cardio-Metabolic Research in Africa.